Hi, and welcome back to the show, Your Life's Transformed. I am your host, Dr. Hamilton, and I am excited to talk to Dr. Maltais. He is a cardiac surgeon and author of the book Healthcare Anonymous. I'm really excited to talk about him today because have questions personally. He talks about being burnt out in this healthcare system that we have today. And I like one of the quotes you used was, is your health system that gets you well getting your workers sick? And so I kind of labeled that with this title because I think that's perfect. I don't know if anybody has asked that question, especially with the pandemic. And so thank you for being on the show. I'm really excited to talk to you today.
Thank you for having me. I'm excited.
And so you are a pretty well accomplished cardiac surgeon with all these, published articles and, working in a top hospital. And so as a surgeon myself, I was joking because I was like, I would love a lot of advice from you as a burnt out surgeon over here in Texas, And so I'm curious to see how you kind of even came up with this or even noticed this problem.
Well, thank you. It was an interesting journey because it was really gradual, and we always think about burnout or anxiety or addiction as a end result or a very acute moment, right, where it's obvious, right? People
Yeah.
can't get out of bed, people are just losing it at work or some. And for me, before even learning or reading about burnout and anxiety and things, I always had this perception, right? And but by reading more and by analyzing my own sort of professional and personal challenges, I realized that it was for a lot of us, it's much more subtle than that, and
Hmm.
it's a lack of empathy. It's
Hmm.
being short, being angry at work. It's just feeling overwhelmed. It's not being able to manage your schedule. It's the little drinking here and there, and a lot of there. There's just a lot of little things that, for me, for years, it was just not adding up. Everybody was driving in the wrong lane, so to speak, and I was the one driving in the right lane, and just to a point where it really came obvious to me. Like, if you look at the trajectory, um, I was on a sprint, right, with my
Yeah.
professional career to accomplish. I was flying every 2 weeks somewhere in the world to give a presentation. I was one of the busiest heart surgeons at the Mayo Clinic, and yet, um, there was this deep void and this sort of extreme fatigue and just miscontent with my overall life. And so, had to take a little moment and started a lot about it. Started with really with journaling, and
Yeah.
and I didn't know the power of that to start with. Um, but gradually, and now with this new book that I just read, it's called Green Light. I think journaling became a key, a central part for me to just start a journey, and that's how the book started a little bit. The journaling and the sort of realization that something was off.
So, at what point, so how far in your career would you say that you noticed something was quote unquote off? And then how far after that did you feel like, okay, I want to start doing something? I'm just curious for you because, as new surgeons, right? We're exhausted from residency, but then we come out and we're like super excited, you know what I'm saying, to get started. And it hit me too. Like at some point, you're like, go, go, go. You're like, oh, I got to publish. Oh, I got to do keynotes, grand rounds. Like all this stuff. And then you're just like, whoa, you know what I'm saying? So I'm just curious when it happened for you, like how far after training?
Yeah. Well, it became acute, I'd say a decade after,
Yeah. Mm.
and but that's what I'm trying to picture in the book. The burnout is to me, and I think I'm trying to really change the thinking around it. for a healthcare worker, it's the end result of multiple years or
Yeah.
multiple issues that are good, that are wrong, that are sort of really forged within this. I describe this triangle of disease, right? Where you have the host, meaning the person that's studying, the nurse, the way you sort of get into the culture, get into the historical landmarks of your profession, and the way you develop those personality traits, and when, in your,
Yeah.
like for me, we've acquired, I mean, they say you acquired most of your personality traits between 18 and 30, and that's exactly where we were on call doing all these hours,
Yeah.
and so you're being pushed upon these responsibilities without having the underlying ability to develop the traits of personality without the kinks to it. So that's one. And then the environment itself, right? The demand, the
Yeah.
competition, and then the way we interact with it. And so when all these three things kind of come together, you can be pretty much in balance. But when one of these things kind of just don't work, whether you, the environment asking too much, or the way you've interacted with some of these things, or have acquired some of the historical perceptions or culture, that's where things like burnout or anxiety or things kind of come out. And if I look back at this triangle of disease or healthcare disease, unfortunately, it probably has been there since I started studying,
Yeah.
and learning how to function as a surgeon, as a medical student, in this sort of very high performing world.
Yeah. Yeah. Yeah, I agree. Like it was probably a decade for me too. And then I kind of had to switch gears, and I've seen it a lot in my nurses too, especially like over this pandemic time where they're just like you said, the acute problem. They don't want to come back to work, right? They're like, And I remember specifically working with this nurse who I worked with for years, and I saw a huge change in her to the point where I was like, man, I'm dreading to almost like working, like just bringing everybody down. Like that's what I think what you're describing as acute. Like it's already, she's already burnt out at this point.
Yeah,
Like in order to have resolved that, we probably needed to go back a few years, but it's just like everything asking to do anything was just like painful. You know what I'm saying? And so it's really unfortunate that in our society we let it go until it's already like kind of past the point, when it's like somebody has to say, okay, you need to probably step back because it's obvious now that you're burnout. And this topic just came, it really wasn't that popular, and probably for you too, during surgery training. Like this like didn't even, and I'm like, this was not nothing, you just kind of keep going, and the way in healthcare you're trained is just like, okay, keep going, suck it up, it's okay, and
yeah,
then it becomes almost like a mismatch, like you were saying. So
yeah.
I guess,
I
how can
remember.
people identify this like before this acute stage?
Yeah, and I remember, as you were talking, I remembered some of the things that, in training, it felt normal, like having this conversation with my first day of my cardiac surgery residency. I remember getting into my mentor's office, and he said, "So you're the guy on call now, and you need to know everything. Like if the I remember even him saying, if the daughter of the patient is cute, I want to know about it, But remember, if you call at midnight, it's going to be seen as a sign of weakness. And
Yep.
and thinking back, and then it was this saying, a DTRT, right? Do the right thing. And
Hmm.
so even though you try to call or even thought about calling at 2 a.m., it was perceived as a sign of weakness, and it's hard to
Yeah.
explain to people, right?
Yeah.
But this culture of not asking for help, and I would even go further than that. The culture uh, of a heart. I mean, from my specialty, being a male heart surgeon, and speaking about and about
Yeah.
depression and burnout. I mean, it's a historical world with a lot of, like, um, our predecessors used to be sleeping in the hospital
Yep.
7 days a week,
Yep.
and they were fired on the spot from rounds, and then sneak back the month later with the famous DeBakey surgeons and things.
Yeah.
So it is a bit in the culture, and it's unfortunately still like that. And to
Yeah.
come back to your question, the signs are not always subtle, and for me are not always clear. And you're right to say, when it's obvious, then the hospital and committees and HR usually pretty good about stopping things, right? If you come
Hmm.
drunk at a hospital, if you crash a car because you sleep, or if you come in and you have this manic depressive disorder,
Correct. Yep.
it's pretty clear that you get stopped. Now,
Yeah.
that being said, the mechanism for which the ways from which these happen and then what happens next is not clear, right? So you get sent to charm schools. If you're very angry, you get sent to see a psychiatrist for 6 months with administrative leave.
Yep.
But then 6 months later, you come right back in with the same
The
culture,
same environment, like the same culture.
schedule, and exactly. So for me, as I said, it was subtle. It was like alienating people. It's like being angry for nothing, both at work and at home. It was gaining weight. It was constantly getting tired. It
Yeah.
was not being fired, but being asked to think about another place to work. After
Yeah.
5 years of being in one place, and so just people just had enough of a certain. It wasn't like I was hitting people or anything, but
Yeah.
I was
Correct.
just very short, very black or white, very and now I realize it was become a slow, um, acquired sort of. I was functionally in a burnout state,
Yeah.
and just angry at myself and tired all the time. So yeah, the signs are subtle, and it can go on for many years, because guess what? We're
Correct.
built in a certain way to be really resilient in this in
Yep.
this in this environment. So it's really tough.
Yeah, no, I agree. And by the way, I wanted to give you kudos because I know surgery training. And so to even admit about burnout or anxiety, depression, like that's just not the way we're trained. I actually trained with DeBakey. I'm in Texas. He was in
Yeah,
Houston. So I got very old school surgeon trained, right? And so there was no complaining, no nothing. You just kind of put your head down and went to work. And you're right, being a male surgeon, like this is the kind of the mantra that it looks like. You don't complain, you just work. Like I still have surgeons that are like 80 that are still taking call, and I'm like, you guys probably should retire, or you know
funny.
what I'm saying.
It's funny because today I got an email, very long email from a colleague in medicine, and he is an ICU doctor, and
Yep.
he's helping me with a preface in Montreal, because the book has been translated in French, and then he's reading all this. He says, "Gosh, now I understand why you guys are so angry. Like, why is it so hard to deal with surgeons?" He says, "I don't think. I mean, not that will make the surgeon special, but
Yeah.
it's old school perception and training and historical culture that."
Correct.
Some of us are being trained in, and then he's like, "No, I mean, I know it was bad surgery training, but I didn't know how bad it was,
Yeah.
and
Yep.
how sort of being angry is maybe an acquired just revenge
Yep.
against what you have yourself lived through."
Correct. Exactly. Exactly. 100-hour work weeks, like typical, and
And then,
so
and I remember, but I remember even saying things like, and I can't imagine then saying this even today after the 2 years of, like, I would say, recovery I've had. But I remember when I heard about this 80 hours a week thing, complaining about it, saying this is stupid. People won't learn. You have to learn in the middle of the night in a type A dissection. You have
I just said that. It's
to,
the same thing.
and, but it sounds crazy. 80 hours a week is enough.
Yeah,
What I mean?
I know.
So,
That is
it's
so funny. I said I'm so guilty. I see like and I'm like, how are surgeons going to learn how to operate? Like, you know what I'm saying?
I know,
Like
things have
80
changed,
hours.
but it's things have changed. There's simulation now. There's different things, but yeah. So it's been an interesting journey to try to really understand what all this comes from, and I'm just talking about surgeons, but I think a lot of other areas in healthcare, whether you're an aide, a nurse, or medicine,
Correct.
doctor.
social workers, like
Social work,
everybody.
they
Yeah.
all feel the same things, but differently.
Correct.
And in the book and the journey of I guess getting the testimonials and the stories, I maybe I've enlightened myself about what are those differences and how they're some of the things are common among others.
Yeah, I agree. So you made a good point in the sense that even when you recognize you're burnt out in this healthcare, but honestly, you can even take this outside any job, any whatever the case may be, and you start working on yourself to kind of help cope with that. But then
Yep.
you have to go back into the same environment.
Yep.
So, how does one like deal with that, so to speak? Do you should you just find a new job, find a new career, find like how do what do you recommend for this?
Yeah, sometimes. So we go over this in the book. Once you realize you're afflicted with any disease, right? You can decide to ignore it, and some people can you can ignore diabetes for many years, but
Yeah, correct.
and some people do it. You can decide to treat yourself and live with it, and you could just decide to sort of die from it. And so there's a or let something go. And so the same thing with healthcare. So you can some for some people it will be to let it go, and that's an easier thing, easier said than done, because I just going to take the doctor as an example. We study for 20 years.
Yeah,
You have financial and personal investment. um, it brings a certain social status.
correct.
It brings you security of job, for your family and kids. It also has a certain amount of society perception. And so when you're in a certain situation, and there's example in the book, but where people have studied all these years and 2 or 3 years into practice, this is wow, I need to, this is not what I want to do
What
for
I thought.
my life.
Yeah.
So it makes it very hard to do that. So most of us, I mean, there's a group of people that decide not to change, and that's on them, I think, and it's unfortunate, but it happens. And then there's a middle group that you have to really change something, and change something means a lot of things, and we try to sort of get a step approach to that change in the book. But I think one of the key things is to reassess the pie, right, and then and establish some of the values which are at the time important for you. And for me, 90% of the pie was work. That's how I
Yeah.
define myself. That's how I've neglected my kids. I've neglected my wife at the time. And so reestablishing those priorities and making the pie a little different, and
Yeah.
starting to say no. And I was just reading the book about it. Start saying no. It's some of it, but
Yep.
saying no is very hard in healthcare. So I can't add another patient. I'm going to see a patient every 30 minutes for my consult, and I won't add another.
Yeah.
I did 2 cases today. I won't do a third if it's not urgent and I'm not on call. I
Yeah. And
won't.
that's hard to do from a altruistic, calling it out there. Like to say no, I don't have any more ability to help a patient is not something any healthcare worker wants to do. I just want to throw that out there. That is very difficult for us to
And
do.
maybe if you have to say this too many times during a week or a month, maybe the system has a problem, right?
Yeah.
You need more people. Maybe you need more people that do the same things as you do, so you can divide the work to win. But sort of rearranging some of those things, and then finding things. For me, it was to start writing a book. I started to do a little acting class and things. So I've started to enlarge a bit. And I had just, again, for 2 decades, the only thing that counted for me was heart surgery and being the best of what I do, and
Yeah.
being on every podiums and things. And so when you start loving yourself in a different way, whether it's through your interaction with family, whether it's through learning a script for a mini short film, whether it's
Yeah.
writing a book and talking about something that matters to you, then you start, and there's a slow change that comes, and you do start to ask yourself, well, if I do that other responsibility at work, and if I take this other committee, does it really align with what I want trying to do with my schedule? And if it doesn't,
Yeah.
well, unfortunately, you do have to start saying no. And it's hard,
Yeah.
but but it's okay. People respect that. You say,
Yeah.
I'd rather do it right than do it angry. So
Yeah.
so
Exactly.
so that's been. I mean, it's always a challenge because I do have the disease of wanting to do
Mhm.
one more, and I love operating, um, but it's like living with diabetes. I love chocolate, and I want to eat chocolate, but I can't. So
Yeah.
there's like a constant reminder that you need to really keep that in check to be happy.
Yeah. No, I agree. I agree. I actually went through a very similar exercise recent, maybe over the past year, where you're right. You have to almost like determine what your values are. And the problem is for healthcare workers in general, I would say doctors more so than nurses, but nurses too, like our career, you're right. It's almost like what defines you. Like they'll be like, so who are you? I'm a nurse. I'm a doctor. You know what I'm saying? That's almost like a definition for a lot of people in healthcare. And so that
Absolutely.
label, so to speak, becomes who we feel like we need to be, even if you're a spouse or you're a mom or a dad. That's usually not what you say, right? When people ask, what do you
Yeah.
do? You're not like, oh, I'm a parent. It's always like, oh, I'm a nurse, or,
Doctor,
oh, you know what I'm saying? I'm a doctor, or whatever it is. And so
it becomes.
automatically identifying with that, yeah, that becomes like your main bucket. Exactly.
And yeah, and that's an important. I mean, when I started, because I used some therapy through it, and I think that's one of
Yep.
the messages, to have help and professional
Yep.
help. Um, and um, and then when the lady, it's classic, right? She's like, well, after a breathing exercise, she's like, okay, Simon, tell me about your values. And I name a bunch of stuff. Family. I said, that's not a value. She's like, so it was after a while we were discussing, and I don't even know what a value is. I think I'm a pretty smart person, but I don't, I don't know what. So I had to go. She said, okay, this is your homework. Go read on the values and pick a few, and then we'll talk about it. But then this is all this conversation about values and how they are, they change over time and why and all that
Yeah.
stuff. So, but it's crazy to me that I've lived 40 years or 42 years without even thinking about what my values are. I don't even know what they were. And so
Yeah.
and so it's been an interesting journey, and those traits of character you're saying, like being a doctor is all that I am, or being a nurse is all that I am. These are pretty typical, and there's a lot of similarities to other fields, like being a CEO. That's all they do.
Correct.
You
Or a
know,
lawyer.
a
Yeah.
musician, or being an actor. That's the traits of personality and the addiction to the. I mean, I could have done the music industry disease. I could have done the same
Correct.
exercise. So that, to me, I'm trying to redefine that burnout is not the culprit. It's the 20 years before that led to the event that's important. What you're going to do with it now, right?
Yeah. Correct. And so I agree. And what are some like initial steps, I guess? So you say people can recognize small changes. Is there anything that almost everybody shows signs of that's going through burnout that maybe they can say, oh, maybe I need to look into this? So I guess my first question is there any symptom that people should kind of pay attention to that would be signs of burnout? And then if they have that, what would be like the immediate next thing that they should do?
Yeah. So, I mean, it's interesting you mentioned that, because I did have to discern a bit through the stories, what people were trying to report, and reading through the different stages. I think the, and it's
Is
funny
there
because
a theme, a common
there's
theme?
a common theme, and it's not in healthcare, is the lack of empathy. It's the
Yeah.
numbness.
Yep.
I think when I read people's stories, there's always an event, right, that will kind of make things break loose. But when you read through the first parts of their stories, there's always this detachment. It's not always like lack
Mhm.
of empathy, but it's this sort of distance from family, from emotions, from
Yeah.
themselves, from their patients, from just the feeling of being emotionally, touched by something. And so people oftentimes start doing, and I remember, I in myself, I experienced it with a little bit of distance. I felt like I was somebody at work, I was somebody at home, and then there was this complex interaction between the two. And I could have a complication, but it was a patient's fault. It was she was too sick, or he was too sick. It was always, and then if somebody died, then I didn't allow myself to cry. I sent the resident, talked to the family, and so that kind of things, I think, is. And then I was distancing myself from my son, my ex-wife now, and I felt like at the moment it came with the job, right? That's how it
Yeah.
has to be
Yeah.
yourself. But retrospectively, it was a sign of burnout. And once you
Yeah.
once you feel that, and that's the first step, and it's a hard one. It's to hit that pause button and
Yeah.
to do many things, but to slow things down mostly. Because that racing rat in our head, say that I need to do the next case, I need to go to this
Yeah, correct. Exactly.
email, I need to go to family stuff, I need to just try to come back to be with yourself, and then make room, right? So what I've decided to do, as an example, is I've let off all the committees I needed to be on, and all of a sudden I created time, and I'm okay,
Yeah.
what do I do
Yeah.
now? And I couldn't do 4 or 5 cases a day, anymore. And I've decided to, it was a joint decision. I could have pushed to stay there, but I left the large busy institution for something else. And so creating time, having the humility to do that, is probably one of the first steps. Once you have established that you may be
Yeah.
suffering from burnout, or from initial signs of burnout.
Yeah. Yeah. No, I agree. I think that's very helpful, and I've learned a lot. I'm sure there's a lot of people that can learn a lot from what you went through. Thanks for kind of coming out and stepping out. We see a lot of um psychologists, honestly, like talk about this, but you don't see too many surgeons, kind of waving the white flag saying, and so it's definitely something
And
that
I
needs.
and I'm waving the white flag, but I'm asking people to get on the boat too.
Yeah,
I think
correct.
that's going to. So we hear who talks about these things too is the journalist, right? They love these stories of burnout
Yeah,
surgeons, or burnout, nurses, or even people that commit suicide, God forbid. But
yeah,
there's no movement, right? So this same movement as other movements and I wouldn't compare it to this thing, but say, the Me Too, that kind of stuff. This is a very serious thing, right? Our system
correct,
is going to be impacted for the next decades if we don't
correct,
help people function and decrease turnover and be happier within this
correct.
very high acuity
With
environment.
within the system. So one of the things that we are struggling with here is one of the reasons we have bed problems because of the pandemic is because of the shortage of healthcare staff. It's not so much, I mean, on the news, if you look at the news, they'll be like, oh, no more beds, everybody's diverting. But the reason there's no beds is because there's no healthcare workers,
No bodies. Yeah.
there's nobody to run the beds. I mean, that's so you say decades, it has already started. I had to transfer somebody, I'm in Texas, to another state
Yeah.
who had COVID because there's nothing, and the nurses have all gone into other field. My nurse, we work closely, obviously, with nurses. I've seen them leave and go into admin, be stay at home moms, start Uber driving, anything but
Thing that
healthcare.
away from this job.
Physicians too.
Yeah,
Yeah,
and it has an impact on, I call it, there's no bodies, there's nobody to take care of the patients.
correct.
But it's also the quality. It's also the
I
money
agree.
involved with. I mean, you train a nurse, you train a surgeon, the person decides to quit. It's hundreds of thousands of dollars for a hospital, for a system, and so it's hard to measure, right? It's hard
Yeah,
to put a
exactly.
but I think it's a silent killer just as much as hypertension or other things, you
Yeah.
know.
Yeah,
Uh,
I agree.
and we're just going to keep pouring money into bringing people from somewhere else and giving more money to people that currently work, but we're not
Than
solving
fixing
the
the
problem.
problem. Correct. Exactly. I agree. I agree. I agree. Well, thank you so much for being on the show. I'm sure you talk extensively about this in your book, Healthcare Anonymous, and people can get that at www.healthcareanonymous.com. You have several stories in there, illustrations, ways to prevent it, things to do for anybody struggling with burnout from I like it, the healthcare disease, burnout. And I think you're 100% right, especially with this pandemic. This is going to be a common problem. So I recommend everybody read it. I think it could be useful. And I would argue it probably could be useful for other people that's not just obviously it's specifically to healthcare, but burnout in general. It's not just a healthcare problem.
It's
I mean,
society
it could
problem.
span.
You want to be
Yeah.
as a doctor. I mean, as a patient, if I get my heart surgery in 15 years, I don't want to be treated by a surgeon who's tired, who's drunk, who's whatever. It has an impact on patients and the general public and any other high performing fields and so I hope I say hashtag healthcare anonymous. I hope that people will be entitled to sort of share their stories or of seeing people having similar issues, and we'll make a movement out of it because
Yeah.
bigger than Simon or the book. It's really a cry for help and to try to understand what's happening with our system.
Yeah. I 100% agree. Thank you so much, Dr. Malte, for being on the show. Thank you.
Appreciate the invitation. Thank you so much.